So, welcome everyone to the Nourish Together Gut, Heart, and Mind podcast. I am so excited to have Dr. Ellie Campbell here with us today. She is a speaker, author, double board certified physician, educator, mother, very important, and your dentist's best friend. Now, we'll talk a little bit about why that is. And she wrote an amazing book called The Blood Pressure Blueprint, The Holistic Guide to Defeating Hypertension. Welcome, Dr. Campbell. Thank you for being here.
So nice to be with you today. Thank you so much for having me.
Yes, and I'm so excited to talk about blood pressure and how to prevent it, which is such a big topic. There it is, beautiful.
Yeah.
And also, why your dentist's best friend? Can we start there?
We sure can. So I'm a family physician by training, right? And maybe now going on 10 years ago, I had a patient who I would like to share the story with, because if we got a couple minutes to lead into it, I think it's more meaningful. Dee was one of my favorite patients. She was actually referred to me by her daughter. Her daughter was 43 when she came to see me, hoping to get pregnant for the second time. She'd had an older son, and she'd been to fertility to try to get pregnant the second time around. And they told her that she couldn't, and that there was no chance, and they shouldn't even try because her her eggs and her husband's sperm were incompatible with life. And she's like, but we have a son. I don't think that this is correct information I'm getting. Let me see what I can do. So she'd heard through the grapevine that I was pretty good with hormones. So I worked together with her, and it didn't take very long. In about 6 months, she was pregnant and had a beautiful little baby boy, and everything was great. And she's like, I think maybe my mom needs to see you, because my mom could use some help with her hormones too. So Dee came to see me because she was at that time probably 65 years old, very vital, looked much younger than her birthdays. She was super active, four-wheeling with the grandkids, line dancing with her boyfriend, just keeping up the family business as their accounts manager and bookkeeper. And she was very, very vital. She had high blood pressure, which we took care of. She had high cholesterol, which we took care of. And I got her on bioidentical hormones, which really helped everything feel better. Her memory, her mood, and her very juicy sex life, right? So she was very grateful for all that. And I took care of her for several years, and things seemed to be going along just fine. And one day Dee called me, or the daughter called me, terrified, because mother had not come into work that day. And so Cheryl drove over to her house, knocked on every door, peeked in every window, and found her mother crumpled on the floor next to her computer. She had suffered a massive stroke. She was paralyzed on one side. They called 911. She was rushed to the emergency room. If you get to the ER within 1 hour of a stroke, sometimes they can give you a clot busting drug that dissolves that clot in your brain and magic erases the stroke away. But she was not a candidate for that. So she was stuck suffering from these consequences of dense paralysis on one side of her body. So after she recovered from her acute event, they put her in a stroke rehabilitation hospital to try to rehab and get her faculties about her and learn how to walk and feed herself and see if we could gain any of those functions back. Because often you can with very hard therapy. Sometimes you can't, but often you can. And so while she was in the rehab facility, there was a devastating complication. This is called the hemorrhagic transformation. It happens in maybe 20% of stroke victims. And it's where that area of the stroke that was damaged by the blood clot became so weak that it burst, and it caused a brain hemorrhage, and Dee died. And when I got the phone call that Dee had died from a bleeding stroke, I felt like somebody had punched me in the gut, because I felt like somehow I had failed her. She came to me, and her daughter brought her to me to provide health care for her. And we followed the best evidence-based guidelines in the country. And I treated her blood pressure, and I treated her cholesterol, and I helped her with hormones, and she was strong and happy and vital. But she had this devastating event anyhow. I spent the next 3 years of my life studying everything that I could learn about how to prevent strokes and their related problem, heart attacks. And what I learned in that conference was that the number one hidden risk factor to the number one killer in our country is oral health. And if the patient has mouth bacteria or in their gums, gum disease, periodontal disease, or gingivitis, or a tooth root infection, which is often asymptomatic because it's many times in a root canal tooth, and root canals have had their nerves removed, so there's no pain, but an abscess can be brewing with each chewing bite, pushing bacteria up into the gums as flesh-eating bacteria to destroy the tissue inside the jaw. Meanwhile, with every chew, sending bacteria into the bloodstream that can lead to inflammation and oxidative stress that can drive events. So when I learned this, I went running home and I got on the phone and I called her daughter and I said, Cheryl, I think I might know what could have happened to your mother before her stroke. By any chance, did your mother complain of any problems with her teeth? Did she have any bleeding in her gums? Did she have any sore teeth? She goes, oh yes, mother had a tooth abscess and she had an appointment to go to the dentist the next week to have her tooth pulled. She was on antibiotics, but she never made it that far. And I was floored because based on everything that I learned, that inflammation in that tooth could have very likely been the trigger that caused that stroke. And had I known then what I know now, I would have had a much more aggressive look at her baseline level of oxidative stress and inflammation with blood markers. And had I seen them going up, we could have gotten her to the dentist sooner and gotten that tooth extracted before it ever became a problem. So now, why am I your dentist's best friend? Because I do blood work with leading indicators that tells me that you likely have a dental problem and you need to see the dentist now and don't wait for your regular cleaning. So in partnership with dentists, I now know that no cardiovascular prevention program is complete without a medical doctor, a dentist, and a hygienist on the team.
Mm. Wow. It's such an amazing story, painful as it is, right? Because I feel like every time something happens to somebody in our care, it feels personal.
Yes.
And you are obviously a very compassionate, caring doctor. And so having that happen, when I read that passage in your book, I was really touched by your deep care and concern for her. But how
and I
the
wanted to make sure
gratitude,
that her loss was not for nothing, right? Because of Dee's story, I've now been able to save hundreds, maybe even thousands of lives. In our practice, since we started paying attention to this dental connection and all the other root causes that lead to inflammation in the arteries, we are now 8 years with 0 heart attacks and 0 strokes in our patients. And because we've been able to lower the amount of inflammation, once the COVID pandemic hit in 2020, we had 0 deaths from COVID in our practice, not one patient lost. And I truly believe that that's because we've spent the last 8 years of our practice focusing hard on reducing oxidative stress and inflammation, getting rid of all the root causes that combine together to increase the likelihood of you having a symptomatic event. We can take those away one by one by one, and we can watch on ultrasound year over year that your plaque is shrinking and going away. I was taught once you had plaque, you always had plaque. We could stabilize it. We could maybe prevent it from having an event, but we couldn't make it go away. And I know without a doubt that that is not correct advice. That in almost every patient in our practice, we see plaque shrink over time. If you're willing to do the work.
The ability to heal is amazing, right? And it takes some effort. And I love that you said that, because I was going to say the gratitude for Dee's case, just that it completely took you in this new path that has saved so many people, as you mentioned. It's pretty remarkable. And so much about what you share in the book is about this path and how people can take real steps to help their bodies heal and be able to prevent or improve their markers, especially as it relates to blood pressure and everything else. And
Yeah.
I know that a lot of people think, oh, my parents had blood pressure and now I have blood pressure. And it's just kind of this, given. What would you say to somebody who comes to you and,
Yeah,
and
I
says
would
that?
say that's probably the 80-20 rule. 80% of what you're experiencing is your lifestyle choices, and 20% is your genes. So you might have the family history for high blood pressure or heart attacks or stroke, but you can overcome those genes by an order of magnitude with your therapeutic lifestyle changes. Because your mother had high blood pressure, because your mother smoked and ate junk food and watched TV instead of exercising, and you learned those habits from her, now you too have high blood pressure. But we can change those habits. It's not easy. It's not easy to change your diet. In fact, one of my mentors told me it's easier to change somebody's religion than it is to change their diet. And in some cases, that's true. But if you're willing to do the work, the results can be so profound. Not only are you able to lose weight more easily, get your blood pressure under control, but you can sleep better, your skin is clearer, your digestion is better, your sex life is juicier, and you live longer. So who wouldn't want that? Without drugs, it's about changing your lifestyle.
That's right. And it's a lot of the time it's about changing core beliefs. I love that you meant, compared it to religion because as a nutritionist, I see that a lot. And there's certain things that it's like, don't take away my, or, being really attached to certain things in diet. And then once people understand how that particular food or how that particular pattern of eating or even the certain lifestyle practice, how it's influencing their health in like a very concrete way, it can be really easy to change out of it, right? Depend if they're connected to their goals and they can kind of question some of their old beliefs.
Right. Well, knowledge is empowerment, right? And many people feel powerless to manage their health concerns, especially if they're going to a conventional medical doctor, right? They go with a complaint and the solution is a prescription. And the prescription didn't solve anything, it just manages it long term. Well, if you see someone who's a bit more enlightened and who's willing to look deeper into the root causes of why it is that you're suffering these symptoms, then often we can fix many, many things by fixing one thing.
Okay. And so is that when you started your journey into functional medicine and more root cause medicine? Was that 8 years ago or?
No, actually, I started my functional medicine journey probably 16 or 17 years ago. And it started with hormones, bioidentical hormones in particular, and then adrenal and thyroid. So I was focusing very much on an endocrine perspective. Of course, in functional medicine, all roads lead to the gut. So we learned about gut. And yet, I was ignoring the beginning of the gut, which is the mouth. I hadn't had enough education yet until about 8 or 9 years ago to understand how much the mouth was connected. For crying out loud, we swallow 1 to 1.5 liters of saliva every day, teeming with bacteria from our mouth. Of course, our mouth and our gut are connected. Of course, our gums and our gut talk to each other. There's bidirectional communication, and there's all kinds of cellular signals that happen, not just the bacteria, but other cellular signals that affect how one organ talks to the other. And if our gums are not healthy, our gut can't be healthy. If our gut's not healthy, our gums have a hard time. So we work on the whole thing. And if there's not enough nutrition to go around, everybody suffers. So we have to always start with a nutrient dense diet to make sure that we have all the macro and micronutrients that our cells, tissues, and organs need for optimal functioning, detoxification, and repair.
Yes. And with functional medicine, of course, bioindividuality is such a big guiding force of what's right for each person. But with that said, are there maybe a set of 3 or 4 different top sort of superfoods that you feel like most people should be really focusing on for that gum and gut health?
Yeah. I would say the first thing is our greens, right? We really want to try to get as many greens as we can comfortably eat in a day. And the gnarlier, fibrous, hard to chew kind of vegetables, the higher the fiber content is. So I would say that probably the number one thing is fiber, and that comes from micronutrients. I'm sorry, that comes from green and leafy vegetables for the most part. So, and fruit too. Don't want to discount fruit, but not so much fruit that you're neglecting to get your vegetables as well, especially because of the lower glycemic index of the vegetables. The next thing that I would focus on is carbohydrates. And I think that we need to have a healthy amount of carbs. The world today is focusing on only a low carb diet. And I don't know that that's the best solution for every patient. Certainly individual variation. There are some who do better on a very carb restricted diet, but many, especially those who suffer from mental health disorders and serotonin imbalance, they really do better with some carbohydrates. So we want to choose carefully and choose high fiber carbohydrates, our whole grains, for example. Again, the nuttier, the more close to nature it is, the better. I make this analogy that if you're out at your fire pit in your yard and all you have is a giant log, how long is it going to take for that giant log to burn, and how successful are you going to be in getting that log to get started? And the answer is not very much. You need some kindling. So let's take a hatchet and cut that log in quarters, and then take one of those quarters and cut it into slivers, and then take one of those slivers and shred it into wood chips. And now we have the same exact wood, but it's in all these different forms. One is highly processed, sawdust. It burns in a flash. It's going to start our fire. Really, it's going to burn super hot, but go out really quickly. Then we have the kindling, burns a little more slower. Then we have the quarter log, burns a little slower. And then we have the rest of the big log that burns the slowest. And carbohydrates are the same. The more we process them, the more we pulverize them into a sawdusty powder like white flour, the higher the glycemic index, the less nutrition we're going to get from it. It's going to flash and burn and get out of our system. We want those really dense, gnarly, chewy, nutty whole grains. So not whole grain flour, but whole grains. So we have.
I love the fire analogy. That's wonderful.
Yeah. So we have our greens, our grains, and then our complex, our simple proteins. And I am a believer that most people do better if they have some animal protein in their diet. It doesn't have to be a flesh food, but some dairy product or some egg, and it doesn't have to be every day, and it doesn't have to be every meal. But a clean quality protein is really good. And it turns out that there's one that's a bit of a surprise I learned about this weekend, and it's Parmesan Reggiano cheese. That's so surprising. And that particular strain of Parmesan cheese has a lactobacillus in it, a fermented probiotic, and it is so healthy for our gut. It's one of Mother Nature's superfoods. It takes a very long time to make it, and it's a very, very nutritious, delicious protein fat source for our bodies.
Yes, so, and it's one that makes my clients very happy, unless they have a really strong reaction to cow dairy, which in that case,
of course, and some people do.
Yeah,
so
it's
individual.
Yeah.
So, so I think if we, we have to go across the board and look at what our individual tastes, textures, flavors, family history, personal and religious cultures tell us that we should be eating. So there's a lot of individual variation. I think diets are as unique as our fingerprint, right? And what's the perfect diet for you is not the perfect diet for me. And that's where some of the art of practicing nutrition and practicing medicine comes into play, is finding that fingerprint diet for your patient that they're going to enjoy for the long term.
And even at different times in their lives, I wonder, with all of your hormone background, understanding for women, especially that at different times of our cycles, we have different needs for different foods. Even the carb to protein to fat ratio can really change, right? When we're building progesterone versus when, estrogen is dominating. So I don't know. We we could get into that for a second, but I definitely want to come back to the book. But is there anything
Yes.
you'd like to add just about the female body when it comes to diet?
I would say that if what you're doing isn't working for you, your medical doctor might not even be the best person to talk about it with. You might want to find a functional medicine or integratively trained nutritionist to help you on your path, because that's what they've spent all their training, continuing education classes, and clinical experience working on.
Yeah, wonderful. Thank you. And thanks for the plug. Well, so going back to the book a little bit, one of the things that you talk about is that people are probably measuring their blood pressure incorrectly. Uh,
Yeah.
so can you say a little bit more about that?
Yeah, I was shocked. So I'm gonna tell you a little secret. The book wasn't originally gonna be about blood pressure. The book was gonna be about your mouth. The book was gonna be about the ways that your mouth can affect the rest of your health. And so
Okay.
when I wrote that book and I pitched it to 82 different publishers, nobody wanted to publish it. And so I thought, well, I must be missing the mark here. People must not want to know about their mouths. So I went on to Google and I looked at Amazon and I looked at Google searches to see over the last 10 years, this was right before COVID, over the last 10 years, what health topics were people really interested in? And it turned out that blood pressure came in the top 10 of what people were more interested in than any health topic. And I thought, well, I know about blood pressure. I guess I check it in my office 10 or 15 times a day. Surely I must be some kind of an expert. So I went online to start studying and making sure that if I was going to write a book about the way the mouth affects the blood pressure and other things about blood pressure, I wanted to kind of get up to date. So I started at the beginning. Well, how do you check blood pressure? And I looked at the CDC and American Heart Association guidelines, and I was shocked that I was doing it wrong. I've been practicing medicine for almost 30 years and I wasn't checking blood pressure right. Like, who knew? So what has happened over the last, since 2019, is we've tried to standardize so that if everybody learns how to measure blood pressure the exact same way, then I can compare my blood pressure in my office to yours in your office to that at the dentist's office. So if we all have the same rules and we follow them, now we can have a even playing field across all healthcare practitioners. So the first mistake that I made was checking patients with a full bladder. The protocol in my office was for them to drive from home, knowing that they needed a urine specimen, having their big cup of coffee so that they had a very full bladder as they were pulling into my parking lot, make them wait in my waiting room with a full bladder, take them to the back where the medical assistant would take their blood pressure and their history and enter that stuff in the computer, and then now please go to the bathroom and give me a urine specimen and the doctor will see you in a little bit. Well, that whole while they were holding their full bladder and they were getting pain because their bladder was so full because they had to go, but they know they needed to wait, we could jack their blood pressure 10 to 30 points above baseline by having a full bladder. So the new protocol is the second they hit the front door, they're told to go to the bathroom and leave a specimen. We don't even always need it, depends on what they're coming for, but every patient empties their bladder so that when we bring them to the back to check their blood pressure, they start with an even playing field and an empty bladder. And some people's hypertension gets cured just by that one thing, just by checking
Amazing.
with an empty bladder.
Yes, it's all in the details, right?
It's all in the details. The next thing is I have a slight medical condition that I am vertically impaired. I am only 5 feet tall, and I have a problem sitting in a chair. I cannot sit in a chair, in many chairs, with my bottom to the bottom, my back to the back, and my feet on the floor all at the same time. If
Mm.
my feet are on the floor, I have to scoot forward. My back is not against the back. Well, according to the new blood pressure guidelines, we have to have our feet on the floor and our back supported. If we don't do that, we use our back muscles to support, or our feet are dangling, we can raise our blood pressure 10 to 15 points. Using those back muscles, your core, to support you puts an extra amount of pressure on your abdominals, and that raises your blood pressure. So we want to have a relaxed back. Many times we would mount the blood pressure cuff on the wall behind the exam table. So that the patient would have to jump up on the exam table to sit there to get their blood pressure checked with their feet dangling. And touching the floor. That's a mistake. We can get a false reading of 10 to 15 points by having dangling feet. So now, and I have never in 63 years of being a patient been offered a stool to measure my blood pressure. But now we have a step stool in our exam room. And if the patient is short enough that when they sit with their back supported, their feet don't touch the floor, we have them rest their feet on the step stool so that we can follow the American Heart Association guidelines with back supported and feet on the floor.
Wow, it's huge. That's huge. I hope people listening can advocate for themselves too. When you go get your blood pressure checked, make sure you pee, and then make sure you're well supported, right?
Well supported, yeah. And I want people to be kind about it because, I mean, I'm a pretty good doctor and I wasn't doing it right because I hadn't had the class yet. I hadn't been educated. And many experts, even cardiologists, even kidney specialists who specialize in blood pressure, their staff hasn't been to the class yet either. And they don't know these rules. So they're 2019, they're not that old, but they're not that new either. But they just, if they haven't caught up, it was the middle of a pandemic. Who was getting new education during that time? Many people not. So we want to be kind about it. And we just want to say, hey, I looked at the CDC guidelines and it says I'm supposed to have my feet on the floor and you're not supposed to measure my blood pressure until that happens. Can we find me a different chair? Can I have a step stool? I'd like to follow the rules. And, don't point your finger and scold them. That doesn't provide help for anybody. Let's just try to kindly educate and bring them up to speed so that perhaps a shift can happen in their office for the future for their next patients.
Right. Is it something, I don't know if you know if this data is right, that is 17 to 18 years from the time a new study or a new guideline takes place for it to actually translate into the practices in the doctor's office?
Yeah, I think that's true. So hopefully with this book and a grassroots effort, we can move that needle a little bit faster. Another thing is you want to have your cuff, your blood pressure cuff, the proper size. Many of us, compared to 30 years ago, we have much thicker arms than we used to. So the medium-sized cuff doesn't fit. So they go and they grab the extra large cuff. Well, I'm only 5 feet tall. I don't have a humerus length that belongs to an extra large cuff. So I need a special cuff made by Welch Allen called a large, long cuff. It's large, so it gets my whole arm, but it's not extra large. It doesn't go up to my shoulder, but it's longer, so it wraps around my slightly thicker arm. Because it's too small of a cuff will give you false blood pressure readings. So you want to make sure that you have the proper size. And for health professionals, anybody listening, there are specific guidelines. You can measure with a tape measure the millimeters of the width of the arm, and then it'll tell you exactly which size cuff to be using. But we ended up buying a separate cuff in my office because of these new guidelines. So now we have the small, medium, large, extra large, and large extra long. And that's what most people in our office are measured with now is the large extra long cuff.
Okay. Wow.
That needs to go on your bare arm, not on your t-shirt, not on your jacket, and especially not on your sweater. If you come from a northern climate and you go to the doctor's office in a sweater, they better ask you to take that sweater off before they check your blood pressure. You could get 20 to 30 extra millimeters of mercury on your blood pressure reading.
Wow. I'm going to repeat that. Make sure it's bare arms. That's big because I can think of many times when I've gone in and my blood pressure checked on whatever I was wearing. So
They try to smooth it out so there's no wrinkles, but that doesn't meet the guidelines. We're trying to standardize and do this the same way every time. So it doesn't matter if you come in your t-shirt or your long sleeve dress shirt or your dress or your sleeveless beanie, right? It doesn't matter. We want to bare skin that way. We shirt the same way every time.
Wow. This is so rich, and there's so much more I need to get to. I need to do a two-part, but I'd love to ask you as far as some of the lifestyle practices that talk about in the book that you have worked on with patients and that you've had such great success with. What are some things that both people can do at home for themselves, and also some complementary modalities that can really help with, specifically focusing on blood pressure now, but obviously everybody can tell the conversation can be very helpful for many other issues.
Yeah. Well, I think that in today's society, so many of us are stuck in sympathetic overdrive. That means we feel as if a grizzly bear is about to eat us all the time. We have this emails, only this much to answer it. We have this many bills and only this much money to pay for it. So we feel stressed all the time. Now, hormone drives our stress is adrenaline. Adrenaline raises your blood pressure so that you can fight the grizzly bear better. You need higher blood pressure to fight that grizzly bear. So we need to get out of sympathetic tone and into more parasympathetic rest and digest. And there are many, many ways to do that. Meditation is a great way to do that. Prayer is a great way to do that. Time in nature is a good way to do that. And we say nerves that fire together wire together. So the more time you spend in sympathetic overdrive and grizzly bear chasing you, the more you're going to stay that way. But the more time you spend in gratitude and prayer and meditation and peace, the more your nervous system is going to stay that way. So practicing, and it has to, for most people, it needs to be at least an hour a day. It doesn't have to be all at one time, but about an hour a day in quiet, peaceful gratitude. And you'll be shocked at how your blood pressure can come down when you do that. I will frequently do a little round of breath work. There's many examples of different types of breath work in the book. My personal favorite is be 5 breaths in and 5 breaths out. So if we go 1, out. Just in that one breath cycle, you can already feel your blood pressure go down. You repeat that 3 or 4 times, it takes seconds to do, but you can reboot your sympathetic nervous system. So very, very simple. There are some acupressure points in the book that are very easy, and they're not a solution for long-term hypertension. But if you're suddenly in crisis and can't get your blood pressure down and you're trying to decide, do I need to go to the emergency room? Can I manage this at home? Is there something I can do? These acupressure points can really help. One is the middle of the middle, so it's the long finger, and you just press on that point with the tip of an ink pen or an orange stick or chopstick, and massage on the tip of the finger. And the other one is called the liver 3, and that's in the ball of your foot, right where the toe bones and the foot bone. There's a picture in the book of where that is, and a little gentle massage on that can sometimes bring our blood pressure down. So I think if we learn some breath work and we learn some acupressure points, those are really easy at home, free modalities to help us bring our blood pressure down.
Yes, and I also love there are so many apps today. People can have access to free content, like Calm, Insight Timer. Obviously, in your book, as far as the breath work or meditation, I know that it's simple. They feel that it's really hard to sort of sit and clear their minds or whatever their notion of meditation is. But I'd say I have some recorded guidance too for my clients so that it just helps you get into that space where you can use a very simple breath to completely change your nervous system response in that moment.
Well, it's like training a puppy, right? You don't train a puppy in one day. It doesn't go from being an out of control, no manners, no tricks animal in one day to the best dog you've ever had, right? It takes a few minutes every day, building one trick on the next, and pretty soon you have a dog who can run an obstacle course, comes when they're called, and walks nicely at heel. But it takes a long time to do that. give yourself grace. You have to learn how to do this, and it's okay. And each day will be better than the last.
Beautiful. Well, and is there anything else as far as, you mentioned the acupressure points. Again, these are things we can all do at home. We talked about some of the foods and those greens and whole grains and your clean protein. Are there any additional modalities that you feel like people can really go, say, maybe before they start a medication, or even if they're already on medication, are there modalities that can also help sort of from the outside in to bring more
Yeah,
balance?
I would say there's a micronutrient that's missing in most hypertensive patients. Many medical doctors are quick to jump on the low salt bandwagon and say, you need to give up salt. Too much sodium is driving your blood pressure. And for 20 or 30% of patients, that's really true, but not the majority. And even among those who are salt sensitive, it's been my personal clinical experience that these patients are almost always deficient in magnesium and sometimes in potassium, but especially magnesium. So if we start, it's really hard to get magnesium from our diet. We used to be able to get it from eating leafy greens and vegetables, but the soil is so
So
depleted that
depleted.
we don't get it from our vegetables the way we used to. And if we do a blood test and our magnesium level is not in the upper quartile, the top 25% of that reference range, you're likely suffering from symptoms of low magnesium. So when we add magnesium, miracle things can happen. Your blood pressure can come down, your nighttime leg cramps can go away, your constipation can be resolved, and sometimes we even cure migraine headaches. So all from that one magnesium. It's involved in well over 300 enzymatic pathways in our body, and it's critical. In my experience, if you are magnesium replete and you have enough magnesium in your body, you can tolerate way more sodium without your blood pressure going up. And that's nice because salt makes food taste better. So I don't want to have to restrict it if I don't need to. And the way for me to know is for me to do the test. I'm going to give up sodium, go on a very low 2-gram sodium diet for a week. I'm going to check my blood pressure 10 times in that week. And I'm going to go liberal on the salt and eat a lot of salt and see how my blood pressure is. And one thing that I have found is that for the really crunchy moms, the one who are really, really into making all their own food at home, they don't do anything from a box or a frozen or a bag, nothing's canned, they're doing everything fresh. They're often profoundly sodium deficient, salt deficient, because the rest of the world that's eating roller food and boxed pizzas and canned vegetables, there's a lot of sodium in all those foods. If we're not consuming those, we may not be getting enough salt, and that can make low blood pressure a problem too. So it's all about balance, right? Everything in life about balance. We need to have enough, but not too much.
And you mentioned the potassium, which I feel like electrolytes is definitely a big part of the conversation because not just sodium, but people can be depleted or they might not be absorbing them as well. So what about the potassium? What would you say in that case?
Yeah, I think a lot of people are potassium deficient, so that's in our electrolytes. They do make light salt, which is half sodium chloride and half potassium chloride. So for people who are running low on potassium, especially if their blood pressure medication includes a diuretic, such as hydrochlorothiazide or chlorthalidone, these strip our body of electrolytes, including magnesium, potassium, and sodium. So we may have to be repleting some of those more, and taking electrolytes can really help. And it's pretty easy to do. You just have to find something that you like to take. Homemade chicken soup's pretty good electrolyte brew.
Yes, and chicken broth, all the broths. How about coconut water? What is your thought on coconut
Yeah, I love coconut water. I think that's a really excellent choice for electrolyte replacement. And
water?
another thing I heard is adding watermelon juice to the coconut water, especially in the summertime, makes a super refreshing, high electrolyte and full of citrulline, which helps drive the nitric oxide pathway that can lower your blood pressure. So it's a very refreshing and nice middle of the summer electrolyte drink.
Sounds delicious. And how about, are there any, you mentioned nitric oxide, and I know there's a couple of nitric oxide exercises out there and things that
Yes.
are specifically related to movement. What is your take on exercise and movement
Yeah,
for
I
blood
think
pressure?
I think it's absolutely critical. We have to be careful that we're not overtraining. Like I said, everything in balance, not too much and not too little. Many of my patients believe that if they're super exercisers, they're triathletes, they're marathon runners, that they're doing good things for their health. And the honest answer is that's really hard on their bodies. And most people don't handle that very well. They need to spend an extra amount of time after their event repairing and renourishing their bodies, and often they don't. They jump right into their next event. So work with a nutritionist if you're an endurance athlete of any kind to make sure that you're getting adequate amounts of protein, electrolytes, micro and macronutrients to repair your body from the damage that you've done, and make sure that your oxidative stress markers have come down to normal before you go into your next event. But I do think that exercise is excellent when it comes to raising nitric oxide. One of the best things you can do is hum, not so much singing, but humming. That vibration of the soft palate really helps stimulate the vagus nerve, and that really helps generate more nitric oxide. But you have to have a healthy mouth and healthy mouth bacteria in order to have enough of the enzyme that we need to make nitric oxide. So
Yes, so humming. And if you love walking or hiking, hum and hike, hum and
very good.
walk.
It's a plan. Let's go. Where do you want to go next?
Let's do it. Well, this has been so wonderful. And yes, I would love to have you again because there's much more we didn't even get to this time. But it's been so rich. I thank you so much for sharing so generously from all your wisdom and experience.
You're so welcome. Thank you for having me. I hope that your readers have learned one or two or five things that they can take home with them that are easy to do to enhance controlling their blood pressure, which is one of the #1 triggers for our leading cause of death in our country, which is cardiovascular disease. We want to make sure our blood pressure is always under control, and that's ideally less than 120/80. If it's higher than 130/80, you have hypertension and you need to be involved with a practitioner to start getting that under control. I don't always mean medication. Often we can talk about many other things, but if you're above 130/80, you're starting to increase organ stress that can lead to complications. So get that checked out, get yourself a practitioner and get it under control.
Beautiful. And how can people connect with you and where can they find your book?
Yeah. So my book's on Amazon. It's called The Blood Pressure Blueprint. I have a website called bpblueprint.com. And my day job is at Campbell Family Medicine in Cumming, Georgia. So campbellfamilymedicine.com. I'm Dr. Ellie Campbell in Cumming, Georgia, a suburb of Atlanta.
Beautiful. Thank you. I hope people connect, reach out, and get the book. It's just so much value in there. And thank you again.
You're so welcome.